promised in my summary to mention suicide, and here it is. Obviously, suicide is one of the worst side effects of depression. It increases the likelihood of suicide by about 20 times. In other words, a very high risk factor associated with severe depression. All psychiatric conditions actually increase suicide risk. Anorexia does, drug use, chronic pain, post-traumatic stress, anxiety, impulse control disorders raise the risk. They all raise the risk of depression, but none as much as depression. Raise the risk of suicide, but none more so than depression. Now, how do you tell if a person is on the threshold of suicide? They may precede the act of suicide by making little threats and jokes about topping themselves. They may tie up loose ends. They might write a will or tell you where your will can be found. So, something like that might be a clue. An interesting one is that there have been many reports of a sudden elevation of mood just before the act of suicide. Suddenly the person seems happier and more settled. They've made their decision and they're ready to go with it. So it might be something to watch out for. The background risk factors, of course, include family history of suicide, lacking social support, and the availability of means, which is a big thing, particularly if you've got guns in the house. That can increase the likelihood that you're going to shoot yourself. There are sex differences. Women attempt suicide roughly twice as often as men, and they're more often using overdose of drugs, which is perhaps why it doesn't succeed. You can get actually saved if you try to kill yourself with drugs, brought around by the medical services. Men actually succeed in killing themselves twice as often as women. And the reason is that they use decisive modes like shooting themselves. Transsexuals and lesbians have a slightly elevated risk of suicide compared to other sex orientational groups, although that is something that might change with increasing tolerance in society of differing lifestyles. Young people, older people have higher rates. Previous attempts, of course, predict future attempts, particularly when it's a violent mode like trying to hang yourself, drown yourself, jumping off a cliff or building, or shooting yourself. All of those, if you've done them before, you're likely to do them again, much more so, and to use the same mode on the second attempt. Nightmares following a suicide attempt seem to be a bad sign in terms of the likelihood of repeating the attempt, but other sleep disturbances were not connected in this particular study, Scandinavian study. Now, it's not much use asking your patients if they are thinking of killing themselves because they're unlikely to tell you. They tend to conceal their intentions. 2/3 or more of them will deny having had any intent to kill themselves shortly before they do so. Now, there are more subtle laboratory tasks that will help identify people who are at risk of suicide. And they use word associations and reaction times, typically, to give clues that are not fakeable. One test is called the Stroop, and the Stroop test works by interference between the meaning of a word and the color in which the word is depicted. And people who are actually more likely to go on and kill themselves find it more difficult to describe the color of the word because they are so absorbed attending with the meaning of that word. That's how the Stroop test works. Implicit associations, I don't know whether you can actually read these words, but in this instance you have to say whether suicide goes to the left of that continuum or to the right of it. We've got life and death, not me and me, but you can shuffle around these words. And the research of Nock shows that where people have a strong association between the concepts of self and the concept of death or suicide, they are 6 times more likely to attempt suicide within 6 months of testing. And that's a much more powerful prediction than any better-known predictors, including depth of depression, history of suicide attempts, or their own or clinician expectations of how much at risk they are. So there's the research on how to calculate the likelihood that a person is going to kill themselves. There's also research on biomarkers. There is a protein called SAT1, which this chappie has Niculescu, claims is associated with the likelihood of suicide, working partly with predictive studies and post-mortem studies. That is, he measures this SAT1 in people who have killed themselves. So far his work's only involved men and needs a lot of replication, but it's an interesting one, particularly because that protein is associated with cellular damage and stress.